Leg weakness in seniors. How to restore leg strength through 3 key vitamins. As we age, it's not uncommon to notice subtle changes in our physical abilities. After the age of 60, many people find that standing up, climbing stairs, or even walking across a room becomes more challenging. You may feel as though your legs are weakening, with the effort required to lift yourself becoming more noticeable. These signs are often dismissed as just part of aging, but in reality, they can be early indicators of age-related muscle loss, or sarcopenia. This condition tends to develop quietly, without pain or swelling, until simple tasks, like getting out of a chair, require assistance. The good news is that leg strength can be restored quickly with the right nutrients. No intense workouts or expensive therapies required. Clinical research shows that 3 specific vitamins can significantly improve leg strength, with improvements often visible within days. In this video, we will explain the 3 essential vitamins every senior needs, how deficiencies in these vitamins contribute to weak legs, and how to combine them effectively for rapid recovery. Why weak legs? After the age of 60, the body goes through gradual but significant changes. Bones become more fragile, blood flow slows, and muscles, particularly in the legs, begin to weaken. Most people are unaware that the legs are typically the first to experience weakness, making even basic tasks like standing or walking more difficult, even if they feel fine otherwise. According to the American Geriatric Society, seniors lose between 1% to 3% of their muscle mass annually. Over 5 years, this could amount to a 15% loss of leg strength, often without the person even realizing it. 3 primary factors contribute to this condition. Vitamin deficiencies. As we age, our ability to absorb nutrients decreases. This is partly because our stomachs produce less acid, which hinders the absorption of key vitamins like D, B12, and bone health nutrients that are crucial for muscle function and nerve transmission. Poor circulation. Slower circulation means that legs receive less oxygen and fewer nutrients, leading to early fatigue, cramps, and heavy legs. Lack of physical activity. Seniors often walk less and avoid stairs, causing leg muscles to weaken further. Without the proper nutrients, muscles can't regenerate, even with regular movement. Now let's focus on the 3 critical vitamins that can restore your leg strength. Number 1. Vitamin D3, the master switch for muscle health. Vitamin D3 is not just another vitamin. It's a vital nutrient that plays a pivotal role in activating the entire neuromuscular system. After age 60, the body's ability to produce vitamin D3 significantly declines, which is concerning because this vitamin is essential for muscle strength, balance, and overall movement. Vitamin D3 helps the body absorb calcium, which is essential for strong bones. But it doesn't stop there. It ensures that muscle fibers contract properly, facilitates nerve function, and prevents muscle atrophy. Signs of vitamin D3 deficiency include leg weakness, difficulty climbing stairs, leg cramps at night, and even balance problems. Many people mistakenly attribute these symptoms to aging, but they could be early signs of vitamin D3 deficiency. A study from the University of Birmingham in the UK showed that seniors who took 800 IU of vitamin D3 for just 5 days saw an average increase of 19% in leg strength in just a few weeks. Additionally, seniors with low vitamin D3 levels were found to be 40% more likely to fall compared to those with normal levels, according to research from Harvard's Geriatric Research Center. How to restore leg strength with vitamin D3. Recommended dosage: 800 to 1000 IU daily for seniors. If you have a history of falls or signs of frailty, 1500 to 2000 IU daily may be beneficial. How to take it? Vitamin D3 should be taken after meals containing healthy fats, such as salmon, eggs, or olive oil, for optimal absorption. It's best taken in the morning or early afternoon, as it can interfere with sleep if taken too late. 2. Vitamin B12. enhancing nerve health and muscle coordination. Vitamin B12 is crucial for nerve function and muscle coordination. It plays an essential role in the production of red blood cells and the maintenance of a healthy nervous system. A deficiency in vitamin B12 can cause symptoms such as muscle weakness, numbness, and fatigue, all of which contribute to the loss of strength in the legs. 3. Calcium, strengthening the bones for better mobility. Calcium is essential not only for bone health, but also for muscle function. It helps regulate muscle contraction and is essential for preventing muscle cramps and fatigue. Adequate calcium intake can support overall muscle function and strength, particularly in the legs. A vitamin regimen for leg strength. The road to stronger legs begins with understanding the role of vitamin D3, B12, and calcium. Incorporating these vitamins into your diet can help combat the subtle muscle loss that often goes unnoticed in seniors. With the right combination of nutrients, you can restore leg strength and regain your balance and mobility in no time. Stay proactive about your health, and remember that maintaining leg strength and mobility is key to preserving your independence as you age. Regularly monitor your vitamin levels, and consider supplementing with these essential nutrients to see the positive changes for yourself. Vitamin B12, vital for nerve and muscle health in seniors. As we age, maintaining vitality and mobility becomes increasingly important, but unfortunately, one often overlooked aspect of senior health is vitamin B12. Vitamin B12, known for its role in boosting memory and energy, is a crucial nutrient for ensuring effective communication between your brain and muscles, particularly in your legs. It plays a significant role in maintaining healthy nerves, promoting coordinated movements, and enhancing reflexes. However, when your B12 levels fall, the connection between your brain and muscles becomes impaired, and the effects often show up first in the lower body. What happens when your B12 levels are low? If your B12 levels are insufficient, you might begin to experience a range of symptoms, including tingling, burning, or numbness in your feet, leg weakness, particularly when standing or walking, a sensation that your legs are asleep or unresponsive, difficulty balancing, even on flat surfaces, the need for assistance while walking due to unsteadiness, mood swings, mild depression, forgetfulness, and mental fog. These symptoms may develop gradually, and many seniors mistakenly attribute them to the natural aging process. However, they are, in fact, classic signs of B12 deficiency. Recognizing and addressing this deficiency is crucial to maintaining mobility and quality of life. Why is B12 deficiency more common in seniors? There are two primary reasons why seniors are particularly vulnerable to B12 deficiency. 1. Inadequate absorption. As we age, our stomachs produce less acid, which is necessary for the absorption of B12 from food. This becomes even more challenging for individuals who take medications that lower stomach acid, such as ranitidine or omeprazole. 2. Dietary restrictions. Vitamin B12 is primarily found in animal-based products, including meat, fish, eggs, and dairy. Seniors who follow vegetarian or plant-based diets, or those who consume less meat, are more likely to have insufficient B12 intake. Even a healthy diet may not provide enough B12 if these food sources are limited. Scientific consensus on B12 deficiency and mobility. Studies have consistently shown the impact of low B12 levels on mobility in older adults. Research from Oxford University revealed that seniors aged 65 and older with low B12 levels walked more slowly, had poorer balance, and were more than twice as likely to fall in the following year compared to those with normal B12 levels. Additionally, a clinical trial published in the Journal of Gerontology demonstrated that seniors who were given 1,000 micrograms of B12 daily for 8 weeks reported less numbness, better balance, increased lower body strength, and faster reaction times. Vitamin B12 is essential not only for mental clarity, but also for keeping the body balanced and in control. It supports the formation of the protective sheaths around your nerves, aids in red blood cell production, improves oxygen delivery to muscles, and ensures that muscles receive the energy they need to function efficiently. Who is most likely to be deficient in B12? Seniors over 60 are at an increased risk of B12 deficiency. Additionally, individuals who regularly use antacids or acid-blocking medications, follow a low-meat or vegetarian diet, take metformin for diabetes, have digestive disorders like IBS or gastritis, consume alcohol regularly, have undergone weight loss or gastrointestinal surgery, are more likely to experience B12 deficiency. If any of these apply to you, it's a good idea to have your B12 levels tested through a simple blood test. Signs of B12 deficiency that are often overlooked. Some individuals may not experience the classic tingling or numbness. Instead, they might notice subtle signs like clumsiness or dropping objects, persistent, unexplained fatigue, occasional sharp pains, or a buzzing sensation in the feet, feeling lightheaded or weak after standing, mild headaches. These signs are often dismissed as general aging, but they could indicate that your body is trying to tell you something important. Early intervention can help you recover more quickly and avoid further complications. Recommended dosage of vitamin B12. For individuals over 60, a daily dose of 500 to 1,000 micrograms of methylcobalamin is safe and effective. Methylcobalamin is the active form of B12 and does not require conversion by the body, making it more suitable for seniors. It comes in various forms, including chewables, sublingual tablets, and sprays. To enhance absorption, it's best to take B12 in the morning or with lunch, and ideally with a meal that contains healthy fats, as coffee and tea can interfere with absorption. Can you get enough B12 from food alone? While it's possible to obtain B12 from food, it's often impractical for seniors to rely solely on dietary sources. For example, a 3-ounce serving of beef liver contains about 70 micrograms of B12, and a 3-ounce serving of salmon contains 4.5 micrograms. To meet daily B12 requirements, you would need to consume large amounts of these foods regularly. As a result, many seniors find that taking a B12 supplement is a more practical solution. Is vitamin B12 safe? B12 is water-soluble, meaning that any excess amounts are flushed out of the body, making it one of the safest supplements. Even at high dosages, B12 is generally safe for healthy individuals. However, if you are on blood thinners or have kidney issues, it's important to consult your doctor before starting supplementation. Real-world impact of vitamin B12. Many seniors who begin supplementing with B12 report feeling more stable while walking, regaining sensation in their feet, standing more confidently, and even experiencing better sleep once their nerve symptoms subside. Vitamin B12 is not just a vitamin for brain health. It's a movement vitamin that helps restore the connection between your body, brain, and legs. If you've been experiencing unusual sensations, leg weakness, or balance issues, consider getting your B12 levels checked. By providing your body with the essential B12 it craves, you can restore the strength, confidence, and mobility that may have been slipping away. Vitamin B12 is one of the most important supplements for seniors, and it's essential to give your body what it needs to maintain a healthy, active life. The impact of thiamine, vitamin B1, on senior health and leg strength. As we age, various factors contribute to the weakening of our muscles, particularly in the legs. Thiamine, also known as vitamin B1, is one such nutrient that plays a vital role in muscle energy, and yet, it is often overlooked in discussions about aging and health. Thiamine is essential for the proper functioning of our muscles, and a deficiency in this vitamin can lead to several health issues, especially related to energy, muscle strength, and mobility. Causes of thiamine deficiency in seniors. There are a number of reasons why seniors may experience a reduction in thiamine absorption. 1. Reduced absorption. As we age, our digestive systems become less efficient at absorbing thiamine from food. This decrease in absorption contributes to deficiencies that can directly affect energy levels and muscle strength. 2. Medication use. Medications like diuretics, commonly prescribed for heart problems or high blood pressure, can flush out thiamine through urine. Other drugs, such as antibiotics and metformin, may also interfere with thiamine levels. 3. Alcohol consumption. Even moderate alcohol consumption, such as regular wine or beer intake, can hinder the body's ability to absorb thiamine. 4. Poor diet. Processed foods, which are a significant part of many modern diets, often lack adequate thiamine. A lack of whole grains, legumes, and other thiamine-rich foods further contributes to the deficiency. Research findings. Tokyo University Study, 2021. A study conducted by Tokyo University in 2021 revealed that more than 30% of the 300 older participants had poor thiamine levels. These individuals displayed notable signs of reduced leg strength, slower movement, and increased muscle fatigue. However, after supplementing with thiamine, many participants reported increased energy, improved walking distance, and better ability to climb stairs. This highlights the importance of maintaining adequate thiamine levels to support leg strength and overall vitality in seniors. Thiamine's role in supporting leg function. Thiamine supports the Krebs cycle, which is the body's primary energy-producing mechanism. By facilitating the production of ADP, adenosine triphosphate, thiamine allows muscle cells to generate energy more efficiently, recover quickly from physical activity, and maintain strength throughout the day. Additionally, thiamine helps in the transmission of nerve signals, particularly in the peripheral nerves that control the legs and feet. Without sufficient thiamine, it's like trying to operate a car without fuel. Everything may seem to function, but the body cannot move efficiently. Recommended dosage of thiamine. For seniors, the suggested daily dose of thiamine is 1.2 milligrams per day for men, 1.1 milligrams per day for women. However, therapeutic doses for seniors with symptoms of fatigue, nerve issues, or leg weakness can range from 50 to 100 milligrams daily. Thiamine is water-soluble, meaning any excess is safely eliminated through urine, making it safe to take in larger doses under the guidance of a healthcare provider. The best time to take thiamine. It is recommended to take thiamine in the morning to help boost energy levels throughout the day. It should be taken with food, preferably a meal that contains healthy fats or protein, to enhance absorption. It's essential to avoid taking thiamine with alcohol, coffee, or black tea, as these can impair its absorption. Can thiamine be obtained through diet? While thiamine can be found in foods such as whole grains, like brown rice and oats, legumes, beans and lentils, sunflower seeds, and organ meats, most seniors may not consume these foods consistently. Additionally, certain health conditions or medications may further hinder thiamine absorption, making supplementation a more practical option for many seniors. Who should consider taking thiamine supplements? If you experience any of the following symptoms or conditions, thiamine supplementation may be beneficial. Type 2 diabetes. Frequent alcohol consumption. Use of diuretics or medications like metformin. Leg weakness or fatigue, even with light exertion. Unexplained weight loss or loss of appetite. If any of these factors apply to you, it is advisable to have your thiamine levels checked and consider supplementation with a safe daily dose. Is thiamine safe? Thiamine is regarded as one of the safest supplements, even at higher doses. Since it is water-soluble, excess amounts are eliminated through urine. However, if you have kidney or liver problems, or if you are taking medications, it's important to consult with your doctor before starting a thiamine supplement. Many seniors report feeling more energized within just 3 to 5 days of taking thiamine supplements. They notice lighter legs, easier walking, less strain when climbing stairs, and an overall improvement in their energy levels. Adding fuel to an engine that has been sputtering for years is a fitting analogy for how thiamine works in the body. While vitamin D3 and B12 often steal the spotlight, thiamine plays a crucial, though often overlooked, role in supporting energy levels, muscle function, and overall vitality. For seniors experiencing muscle fatigue, leg heaviness, or energy issues, thiamine can be the missing piece of the puzzle. It powers the muscles, restores motivation, and provides the energy needed to go through the day with ease. To achieve the best results, consider combining thiamine supplementation with the right timing and alongside vitamin D3 and B12. Whether you choose to get your thiamine through diet or supplementation, taking a proactive approach will help you maintain leg strength, energy, and vitality as you age. Remember, action is the key, don't wait. If you've been experiencing fatigue, leg weakness, or difficulty staying active, consider supplementing with thiamine. Your body and your legs will thank you for it.